Now, in ACL surgery, an autograft refers to a graft taken from the patient's own body to replace the damaged ligament. There are several common types of autografts used, each with its own pros and cons. I'm going to go through a breakdown of the most widely used options. So the first is the patellar tendon autograft. Now, what is it? A portion of the patellar's tendon is harvested, along with a small piece of bone from the kneecap and the tibia, to form a new ACL. Now, this is why it's called a bone patellar tendon bone graft. Now, the pros of this type of graft, it's strong and stable. So the bone-to-bone healing is very solid, leading to a strong graft that mimics the natural ACL closely. Now, it also has a faster integration, so the bone ends kind of help anchor the graft more quickly to the bones, leading to a faster healing of the graft. It has a low re-tear rate, so it's often recommended for athletes or those in high demand sports due to its durability and low failure rate. Now, every graft will have its cons, so the cons are anterior knee pain. So some patients experience ongoing pain at the front of the knee, especially when kneeling, due to the site where the patellar tendon was harvested. There is a risk of patellar fracture. So the harvesting of bone from the kneecap carries a small risk of fracture. And there's a slightly higher chance of stiffness and loss of full knee extension. Now we have the hamstring tendon autograft. Now, what is this? One or two of the hamstring tendons, usually the semitendinosus and sometimes the gracilis, are harvested from the back of the leg and used to reconstruct the ACL. Now, the pros of this type of graft is there's less anterior knee pain. Unlike the patellar tendon graft, this option avoids issues with kneeling or pain at the front of the knee. It's actually a smaller incision site, so the harvesting procedure typically requires a smaller incision, which can mean less scarring and potentially faster initial recovery. Also, good flexibility. Since the hamstring tendons regenerate over time, it can result in good knee flexibility after recovery. Now, the cons of using this type of graft. Weaker hamstrings. So harvesting the hamstring tendon can weaken the hamstring, which may impact activities like sprinting or sports requiring strong hamstring contractions. There's actually slower fixation. So hamstring tendons don't attach to the bone as quickly as like in the patellar tendon autograft, so it can take longer for the graft to fully integrate. The re-tear risk, so there's a slightly higher risk of re-tear compared to the patellar tendon graft, especially in younger, more active patients. So now we have the quadriceps tendon autograft. Now, it's a portion of the quadriceps tendon above the patella, which is taken with or without a small piece of bone from the patella to replace the ACL. Now, the pros of this type of graft. It's a strong and thick graft, so the quadriceps tendon is larger and thicker than both the patellar and hamstring tendons, which can provide a strong replacement. There's lower risk of knee pain, so the quadriceps graft has a lower risk of anterior knee pain compared to the patellar tendon graft. And it's good for revision, so it's often used for patients undergoing a second ACL surgery or when the patellar or hamstring tendons are not suitable. Now, the cons of this type of graft, well, we'll see quadriceps weakness, similar to the hamstring graft. Harvesting from the quadriceps can weaken the muscle, which may affect jumping and explosive movements in the early stages of recovery. Now, this type of graft is less commonly used than the patellar or hamstring autografts. So some surgeons may not prefer it compared to the other ones.